Hey everybody, welcome back to Ortho Notes. Let's talk about the thoracic spine, osteokinematic and arthrokinematic motions. So the osteokinematic motions, you're going to have flexion and extension, of course, so that will be sagittal plane motion. We will have side bending, which will be frontal plane, and then also thoracic rotation, which is the transverse plane or horizontal plane. So let's talk about the glides that are occurring. So during flexion, we'll just pick a random segment here. Remember, the orientation of the thoracic spine facets are vertical, just about vertical. So this hand would be, if we come from the side here, this would be the inferior facet of the more superior vertebrae. So we're describing the arthrokinematic glide by the motion of the superior on the inferior or caudal vertebrae. So again, the orientation is pretty close to the frontal plane and more vertically aligned. So when we talk about these different translational glides, flexion and extension, for instance, because of the orientation of the facets, we'll describe them as superior and inferior glides. So the facets are synovial joints, they are plane joints, so we're going to describe the motions as translational glides. So as we go into flexion, that will be a bilateral superior translational glide. As we go into extension, that will be bilateral inferior translational glide. With side bending, so now we're moving in the frontal plane. If we side bend to the right, on the ipsilateral side, we're going to have an inferior translational glide, and on the contralateral side, you will have a superior. So side bend to the right and then side bend to the left would obviously be the opposite. So now the left side becomes the ipsilateral side, you'll have an inferior glide, and then the right side becomes the contralateral side, you'll have a superior translational glide. Now rotation. Let's rotate to the left, and I'm exaggerating the glide that's occurring. So here's neutral. I'm going to rotate to the left. So the left side is the ipsilateral side. So on this ipsilateral side, we're getting a medial translational glide, and on the contralateral side, we're getting a lateral translational glide, and then vice versa for right rotation. So now, again, the ipsilateral side, which would be the right side, we're getting a medial glide, and then on the contralateral side, that would be described as a lateral translational glide.